Good morning, everyone. Sorry for the long break between updates. I had some issues with recording equipment, so I've figured that out, I think, and I'm back. Okay, so we'll start with an update because I know a lot of people have been like, "How's everything? I haven't heard anything from since you graduated your OB's office." So when I went to my obstetrician's office, I believe I was 11 weeks. That was my first appointment. I have had 2 other appointments since that time. One was a nuchal screening, ultrasound, and some blood work. And essentially, what they do is they just look at the little fold right here on the back of the baby's neck. It has to be done, I think, within a certain time frame. I don't know, but they told me I had to be there at a certain amount of weeks. And they look for signs, symptoms, something magical, I don't know, about that put the baby at a higher risk or indicate maybe that there is some chromosomal issues or spina bifida issues, things like that. And they also took some blood work at that time. Then I had another visit after that, which was just a regular OB visit. Nuchal screening, they said everything looked good. Baby looked perfect, looked great. And went on my merry way. And then my last visit was actually just last week, I believe. Yeah, last week. It's been a week actually today. And it was the first time we got to listen to baby's heartbeat with the little handheld ultrasound, just the little Doppler ultrasound. So that was really fun. And they measured my uterus. Normal pregnancy visits, they measure from your pubic bone to the top of your fundus, where your top of your belly is. And I was 17 weeks at that point, and I don't know if I'm happy to say or very, very nervous to say that I was measuring 2 weeks larger than what my gestational age was. So at 17 weeks, the uterus was measuring as big as a 19-week pregnancy. So that makes me super nervous that there's going to be a humongous baby that comes out of there. I don't think it's just a lot of fluid. I think it is baby taking up all that space, because I can feel this baby moving all the time. He has a nice little pattern where he is awake and asleep, and I can tell the difference. But he likes to poke me sometimes, and I can. He's a strong boy. He's a strong boy. So I am in that weird in-between stage body-wise where people may not be sure if I'm maybe just had a little too much to eat at the buffet or is she kind of pregnant? So I'm kind of in that weird stage. You can kind of see it. I'll try to show you. You can kind of see it right there. I have to wear my pregnancy pants because my regular pants don't fit, but this from here down is not chub. It looks like chub, but it's not chub. So yeah, it's interesting being pregnant all over again. So that's the biggest update. I've got nothing more pregnancy-wise to say than that. The next visit we do is our anatomy scan. It's the 20-week anatomy scan. It'll be 21 weeks when we do it. Then they'll look at all the parts and make sure everything's going correctly and that he's a happy boy. I did learn this week, however, that my parents are slightly less knowledgeable on normal OB procedures in the pregnancy stage and how OB care goes and prenatal care goes. They were, I won't say upset, but I think they were disappointed that they did not get ultrasound pictures this time. I did video them finding baby's heartbeat and sent that to them, and but they were like, next time can I have some pictures? And my agency coordinator contacted me and she was like, so I heard you had a good visit. How did it go? Did you happen to have an ultrasound? And I was like, no, it was just a regular visit. And she said, that's what I thought. And I go, they said, were they expecting an ultrasound this time? And she goes, I think so, because they're wanting to know why they didn't get pictures. I go, she said something similar to me. I said, I don't think they're really aware of how the prenatal care goes. And she goes, I don't think so either. So I think we've got that clarified, and we discussed it in our little group chat with the agency members and the parents. And she didn't understand. She assumed that we would be doing ultrasounds every visit, which I can understand because we've done ultrasounds basically every single visit up until this point. Every time I was at the RE's office, we were having ultrasounds or blood work or something. So I can understand that all of a sudden we're not doing that anymore. It can be a little off-putting, I guess, when you haven't been through it and you don't know how OB care works. So but she was unsure, like, well, how are you going to know that the baby's in the right position and that he's okay in there? And we had to explain to her, other things that they look for, and as time goes on, if there's a need for more ultrasounds, they'll do it. So hopefully she feels a little bit better. There's a language barrier between her and I. So I hope that our agency owner, who is also Chinese and speaks both languages fluently, relayed the information correctly and put her at ease. So hopefully that worked out. Today's topic, really what this is more about, is safe exercise in pregnancy. I have seen on a lot of these boards and in pregnancy in general, a lot of shaming almost, and just adamant defiance against exercise in pregnancy, which really just kind of rubs me sideways, because the information being given is not correct at all. There's opinions, and there's opinions based off of good information, and then there's the recommendations. Usually opinions are just that. There's no actual anything behind it. It's just somebody's opinion. Opinions based on good information can sometimes be skewed based on personal experience, or he said, she said, or physician recommendation, things like that. And then there's recommendation, the actual recommendation, which is exactly that, is the official recommendation based on evidence-based information, based off research and studies, and it's what physicians should be going off of. I say should because they don't always. And I want to show you guys the site where your physicians go. It's the association, essentially, that OBGYNs are getting their newest information from, where they are getting their opinions from, where they should be getting their opinions from. Not all of them do. Most of them review it and then maybe go with what they're most comfortable with. But what this website presents is information based off of research. This is evidence-based care, which we should all, in theory, be getting. We know that does not always happen, but every person in every setting of healthcare should be getting evidence-based care. That is care based on the most recent education and research. In our case, exercise during pregnancy is the topic I want to show you. So the site I've used is ACOG.org, ACOG.org. It stands for the American Congress of Obstetricians and Gynecologists. It's for women and healthcare physicians. This is their fact page titled Exercise During Pregnancy. So I just want to show you the web page. It's on my phone so you guys can actually see it. Let's see if I can. There's the website up there. So exercise during pregnancy. Now I don't know if you guys can actually read that or if it's backwards on your screen. I do apologize. But for some reason people just completely throw logic out the window when they get pregnant sometimes. And I've seen in some of the groups, surrogate groups, and more so on other social media platforms, like Instagram, for these fitness models or people who are just really in shape and their exercise during their pregnancy. I have just seen some absolute bashing and shaming. Everything from, why would you put your child's life in jeopardy like that? This is so dangerous. You could have a miscarriage. You could kill your baby. Look at how small your abdomen is. Your baby can't even be growing right. You're so selfish. And I want to address that because a similar kind of situation came up in one of the groups, one of the surrogate groups, and I tried to give evidence-based information, but nobody wanted to hear anything. They just kind of wanted to tell me that I was suggesting that this person who asked the question about exercise and lift restrictions, that I was just suggesting that she go against physician's orders, and nobody wanted to hear anything. So kind of pissed me off, honestly, because we're in here to support each other, but we're not actually supporting each other. We're just giving each other our own possibly wrong opinions, and they're not maybe the best information. And the girl was asking about restrictions during post-transfer and during pregnancy, and whether or not she would be able to continue her normal career, her job that required heavy lifting. And everybody wanted to say, no, you're going to be on a weight restriction, which is true and isn't true. During this process, I've had 2 weight restrictions placed on me. The first one was my first transfer, and it was only a 2-week restriction of nothing over, I think they said 20 pounds. So I ended up being off work for 2 weeks because I have to be able to lift at least 50 pounds as part of my job description. This time, with this pregnancy, we have a successful pregnancy, we all know that, and the reproductive endocrinologist, Dr. Shapiro's office, had a 35-pound weight restriction until I was cleared to go to my obstetrician's office, which essentially is the entire first trimester. I went to my first visit right after 10 weeks. I was released from the clinic's office at 10 weeks, and I had my next appointment, I think, the following week. And I was put on a 35-pound weight restriction. I learned about it early in the process. I questioned it early in the process. I asked for clarification. I got clarification. I realized what that was going to mean for me professionally and long-term. For me, it was going to eat up my FMLA leave. It was going to add an incurred cost to these parents that possibly they were not preparing for or suspected or ready for, in the form of about $20,000 extra in my lost wages for this time. And I would have been essentially eating up all of my possible leave if something happened later in pregnancy. I get put on bed rest. I would have been putting my job in jeopardy, and my position within the company. It also, if there was nothing wrong, would have only allowed me a handful of weeks post-delivery to recover, and then I'd have to go back to work to keep my job. And so that's why I question it. And I questioned it a lot, and I questioned it early on and asked if there was any way we could readjust this or if there was anything, and they were very adamant about no. It wasn't until I got my agency, I let my agency know early on, but it wasn't until closer to transfer when I said, hey, just remember that I'm gonna be off work until they clear me for my OB's office. And my agency essentially perked up and went, what are you talking about? And I said, they have a weight restriction of 35 pounds. My employer does not allow me to work if I cannot lift at least 50 pounds. We're gonna have to move a little bit, sorry, because my battery is dying. My agency then was like, whoa, what are you talking about? And they got very concerned that perhaps my parents would, hang on, let me plug this in. I can never find it. There we go. That perhaps my parents would then attempt to back out because it was going to add $20,000. Oh God, all my stuff right here. I was not prepared for my battery to go dead, sorry. Was not prepared for the extra $20,000 in lost wages that it was going to cost to keep me as their surrogate. And I had to then, tell my clinic, because they asked me to then speak to my clinic I told her, this is what my agency is concerned about, and here's what they're worried about. Can we discuss this more? And they gave me good reasoning. I was not unhappy with why they said, they tend to be more cautious during surrogate pregnancies and in this setting. Excuse me. That there's a higher incidence of subchorionic hemorrhages, and that's why they put that on that weight restriction, because essentially if you have an undiagnosed subchorionic hemorrhage and you're lifting, you could essentially shake it loose, and that wasn't a risk anybody was willing to take. And I said, I totally understand that, I get it. So I came to terms with it. If the agency had not really pushed it and had so much concern, we wouldn't have readdressed it. I would have just taken it at its face value and gone on my happy merry way. However, they did. They got a little concerned that the parents would back out and ask that we rediscuss it with the physician. And it took about 2 weeks, but once the physician got on, he said, look, she's already lifting this, between work and her normal daily activities. And as long as she uses common sense, gets help where she needs it, don't be lifting, real heavy people by themselves, don't do anything crazy, then she's okay, she's fine, let her be. Which I did. I always ask for help if I need it. But I took it one step further, and because I know they would rather me be on that weight restriction when I was home, I decided that, okay, no more lifting. I didn't go running, I didn't do any exercise, no gymming, nothing like that. I'm so sorry, I was trying to make this so it wasn't all wiggly. I decided that, there'd be no lifting here at the house. So I didn't do any weightlifting like I would normally would. I was very active before this process, and I've had a lot of, in my opinion, negative side effects from the medications as far as what it's done for my physical health, and my exercise routine. So it was really important to me that if I could get back to working out, I'd be allowed to. I should say that the clinic made it a point during this that to tell me that even during pregnancy, you had a 35-pound weight restriction on you. And that actually one of the girls said to me, quote, I really hope you're not lifting anything heavier than 35 pounds during pregnancy, which I knew was not true. I know the recommendation, and I work with pregnant women who are absolutely lifting during pregnancy, and I don't, it's not unsafe. So it was important to me that this be dealt with. So I got my restriction lifted using common sense, like I said. It's not always like that, so don't expect that to be the norm. But if it is something that's important to you and or is going to cause an issue, you absolutely need to speak to your clinic about it. Don't just ignore the restriction and just do as you say, because say you do this and something happens, the last thing you want to do is feel like it was your fault. The last thing you want to do is go, I should have listened to my doctor, because you should be listening to your doctor. There's a reason they're the doctor. So that being said, now that I am released to my OB's office, and as I stated before in the last video, he has released me to go back to working out, and we discussed at that time safe options for me and how to build my strength back up, because my biggest concern was I lost so much cardio endurance, and I no longer could walk up a flight of stairs without getting extremely winded, huffing, almost asthmatic-like, even just a fast-paced stroll down the hallway at work, which cannot, and I am not even kidding you, cannot be more than maybe, I'd say it's not even 25 yards, was too much. And it was horrendous how horrible I felt in the beginning until I got off the medications. And then as the medications have slowly the excess medications have gotten out of my system and my body is taken back over, I have noticed an improvement in all of that, also combined with me exercising again. But more than that, I've noticed that my weight gain has stopped, and I just don't feel as just bleh. I don't know how else to explain. I just kind of felt blobby with all those medicines on board, all the hormones. So we discussed it, and we came up with a plan that worked for me, and he gave me some restrictions, and I'm following them. I'm not doing anything crazy. I am swimming every day that I can at our local aquatic center. And at first, I couldn't do a half a lap. Our pool is only 25 meters, or 25 yards down, and then 25 yards back. So one lap is 50 yards. And it was 25 yards was too much. There was times when I'd have to stop halfway through and just doggy paddle to the end of the row to get through it, because it was too much. And it concerned me for a while that maybe there was something more wrong, but I don't think it was. I think it was just medications and being out of shape. So I want to give you guys good information here, I'm going to give you a website that we start with, and I believe I told you, the American Congress of Obstetricians and Gynecologists, like I said, is where they're supposed to be getting their information, and this is where I'm getting my information. Let's see if you can see it. Right there. So That's where I'm getting my information, and I'm not going to give you anything other than this information on here. I'm not going to give you my doctor's recommendation, nothing like that. It's just information from this website. And the reason is because, like I said, there's so much shaming in it, and people want to tell you how it's not safe, but according to them, it is. And the very first question is it safe to exercise during pregnancy? And what the ACOG states is if you are healthy and your pregnancy is normal, it is safe to continue or start most types of exercise, but you may need to make a few changes. Physical activity does not increase your risk of miscarriage, low birth weight, or early delivery, which is probably, in my opinion, the most important statement in this whole paragraph, because this is the basis for a lot of negative Nancy's, where it's not safe, and why would you do that, and you shouldn't be lifting anything heavy in pregnancy. And a lot of that opinion comes off of old wives' tales. I know there's some where I think I was told once, if you raise your arms over your head, that your baby's umbilical cord will be wrapped around their neck, which is not true in any case whatsoever. It goes on to state physical activity. Oh, I said that. However, it is important to discuss exercise with your obstetrician or other member of your healthcare team during your early prenatal visits. If your healthcare professional gives you the okay to exercise, you can decide together on an exercise routine that fits your needs and is safe during pregnancy. The first paragraph of that and should, in my opinion, shut down all negative coming towards this. Because ultimately that's what we're told to do, is follow our physician's orders. And if our physician states it's safe, then it's safe. Excuse me. Your physician absolutely is not going to clear you to exercise if there's any risk, any risk at all to this pregnancy or to your health or that baby's health. And I just don't understand why people think that it's not safe to exercise. There's actually so many benefits to it. So let me get down here. What are the benefits of exercise during pregnancy? It reduces back pain, something we would all like to get rid of. Eases constipation. May decrease your risk of gestational diabetes, preeclampsia, and cesarean delivery. Now, these cannot always be avoided. So they are saying may decrease because sometimes we just can't avoid it. Sometimes gestational diabetes happens, preeclampsia happens, and C-section delivery sometimes happens for reasons that we can't control, emergency situations. But if we can give ourselves a leg up on not getting gestational diabetes, I know a lot of surrogates who, before they even, finish their first surrogate pregnancy, they're already thinking about a second. Well, gestational diabetes can rule you out from a second pregnancy. Preeclampsia absolutely will rule you out from a second surrogate pregnancy. They're not going to allow you to carry again. And unfortunately, those disease processes originate from the placenta. But if you're in shape and you have a healthy body already, then you're going to lower your chances of developing those. It promotes a healthy weight gain during pregnancy. We know the heavier you are in pregnancy, the higher the risk of gestational diabetes, preeclampsia, cesarean delivery, complications, shoulder dystocias, things like that. So a healthy weight gain is important in pregnancy. It improves your overall general fitness and strengthens your heart and blood vessels, and helps you lose the baby weight after your baby is born because you're maintaining a proper weight gain. The thing about this is nobody should be going into this in pregnancy going, oh, I'm gonna be that super fit chick, and I'm gonna get so built during this pregnancy. That's not the goal here. The goal is to keep your body healthy, not to make you some Fitspo model on Instagram where you're, posting every day of your crazy workout routines. It's just to make you be healthy. That's the goal. Even if it's just walking around the block and getting that exercise in every day. That's what the goal is here. We're not stating, go be crazy. We just want you to be healthy. There are certain things that you should not, certain times you should not. And I think this is what everybody thinks is going to happen. They state that cervical insufficiency and cerclage, you should not be exercising. And they'll tell you that. They'll put you on rest. They'll put you on bed rest when you have a cerclage, or they're saying your cervix is incompetent or insufficient. In surrogate pregnancies, generally we do not have a history of that. I don't know a surrogate who does have a history of it that was cleared to be a surrogate. So They're stating that being pregnant with twins or triplets or more and having risk factors for preterm labor, you shouldn't be exercising. Placenta previa, preterm labor or early rupture of membranes, preeclampsia or pregnancy-induced hypertension, and severe anemia are situations where you should not be exercising. In that case, your physician is guaranteed to have already put you on that restriction. And it goes back to, we are required by contract to follow our physician's orders. We can't just take, this into our own hands and do as we see please and ignore what our doctor tells us, because we're not carrying our own child, you guys. We all know that. But it's recommended and it's encouraged, and ACOG is the whole page just breaks down so much. What changes occur in the body during pregnancy that can affect my exercise routine? What precautions should I take when exercising? What are some safe exercises I can do during pregnancy? What exercise should I avoid during pregnancy? What are the warning signs that I should stop exercising? And they have about 10 things on here. Bleeding from the vagina being the first one. Feeling dizzy or faint, shortness of breath before starting the exercise, chest pain, headache, muscle weakness, calf pain or swelling, regular painful contractions of the uterus, or fluid leaking from the vagina. Now, I have been exercising, and I have been not pushing myself hard like I would if I wasn't pregnant, but I have been trying to stay pretty active. I am swimming, like I said, and I am lifting a little bit here at home. I don't have anything heavier than 20 pounds at home, so I cannot lift more than 40 pounds at a time, which I think is fine, and I only use that to squat. But I have noticed, even when I'm at the pool or if I'm here lifting, anytime I have to engage my stomach muscles, this little guy comes popping right out of my belly. Like, my whole uterus just kind of goes and comes out like this, and he kind of just, it gets into like a hard ball. It doesn't hurt, it's not painful, I don't feel cramping, I'm having no bleeding, I'm having no leaking, nothing. It's just a tight ball, and I'm attributing that to, because I'm using the muscles are tightening up, and it's just pushing it out. But it makes me a little bit nervous, so I have not been lifting, and I'm going to talk to my physician at my next appointment. It's only in the last week really that this has been happening, and as I said, it makes me nervous. So next time I talk to my physician, I have my next appointment, I'm going to ask him about it. It's not as bad when I'm in the pool, otherwise I would have stopped going to the pool, but it is happening. So it's just different, but it's safe and it's recommended. Swimming is actually on their list of recommended exercises during pregnancy. I will tell you, I feel a lot better when I'm in the pool, when I'm in the water, period. It makes my heartburn feel better. It makes any nausea that I'm having feel better. Excuse me. This little guy seems to like it better. He calms down when we're in the pool. And then he's like, hey, that was fun, let's do that again, and wakes up and pokes me a little bit. So but I really do, I like it. I like the workout I get when I'm in the pool. I don't feel like I'm straining or overexerting myself, and when I get out, I still feel like I've gotten myself a good, nice little workout and exercise and stretched my body out. So it's important that you talk to your doctor about it. I polled some of the doctors at work, and I only had one physician who told me he does not recommend exercise in pregnancy. Everybody else, in one form or another, absolutely encouraged it. So you have to talk to your physician and ultimately go off what he says and what you and the parents are comfortable with, because we do have a third party in this. It's not just you and your husband, or you and your significant other, or you and your girlfriend, or whomever it may be. It's you, your significant other, and the parents of the child. So you have a second relationship there that you have to factor in. I, for one, made it very clear with my mom and my parents early in this that it was important for me to stay active. She told me, anything you need to stay healthy during this pregnancy, we want you to have. So please, if there's anything you need, let me know. And my return to that was, I shouldn't need anything. But it is important that you understand that I am an active person. I run, I go to the gym, I lift weights, and I intend on doing so during this pregnancy. and making sure she understood that that wasn't going to stop, because I didn't want her to be uncomfortable with that. And she was agreeable. She's like, no, that's totally fine as long as you're healthy and you're happy and everybody's safe. And I said, absolutely. If the doctor says it's okay, I can do it, then I'd like to keep doing it. She was very agreeable. Now, fast forward to I'm actually pregnant. And I shared with her a picture of me just getting out of the pool just this week, actually, just a few days ago. And I said, me and your boy go swimming every morning, trying to stay healthy for you guys and keep my body strong for you, so he has a nice, healthy, strong body to grow in. And she got very nervous and said, is this just for sport, or is this okay? Did the doctor say this is okay? Something to that effect. And is it safe? And I said, absolutely, it is safe. I've talked to the physician. Doctor said it's totally okay. I think I'm going to have him reach out to her a little bit and just let her know that this is safe, actually one of the safest you can do, as long as you're comfortable swimming and he's okay with it. And that it's just keeping me healthy. So, but she got very nervous about it, which was it was cute. I thought it was cute, because she doesn't know. And I just want to share it with her, so she didn't think I was just sitting around being unhealthy. I really wanted to be sure that, I'm trying to stay healthy. But she got very nervous. And hopefully I alleviated those fears, and hopefully she will not be so nervous about it if I bring it up again. Maybe I won't, I don't know. But even it's scary for them. They've put this baby in my hands, and they want to make sure that everything is as safe as can be. And maybe they don't know all the way. For the most part, I tend to see a lot of intended parents who have not carried children before, and so prenatal care and pregnancy is foreign to them. It's the mystery, and they don't know what's right, and they'll be more nervous, especially if they've had a lot of losses, and if they've maybe heard from family members or culturally wise that these things are bad or this food is bad. I had a friend who was asked not to eat certain foods during her surrogate pregnancy because the mother believed that those foods were the reason she had miscarried, and so she had some food restrictions on her, and she obliged. She was fine with that. But it makes a difference when they go into it already very, very nervous. So we have to make sure we're doing what's best for you under doctor's recommendations, and for the parents under doctor's recommendations. So you have to discuss it with everybody. Don't just do as you please. Make sure everybody's comfortable with it. So that's what I've been doing. I am going to talk to my physician again about it, because I'm just not used to my pregnancies, I was not a healthy person. I was not active. I had healthy pregnancies, but I was not a healthy person. I was overweight to begin with, not obese, but overweight, and I did not exercise at all. Exercise was not anything I was about until long after my kids were born. But I've learned a lot since then, and now it is very important to me. My physical health is important to me, because I want to have a nice, strong body. I don't want to have the same health issues that my mom has and my sister has and things like that. So it's important to me, and so it changes things a little bit for me, because I don't know. I don't know what's necessarily the right way to do things all the time. Like, I don't know how to adjust for the growing abdomen, and how to adjust not using those muscles like I used to. So I'm going to talk to my physician and follow orders. So, yeah. All right, next time I go for my ultrasound, and I'll have more information on that. So here we go. I'll see you guys next time.